Okay, good morning, Chairman, Co-Chairman, ladies and gentlemen. Okay, my name is Pawin Gajaseni from Department of Orthopedics, Pramagutgrao Hospital, College of Medicine. This investigation was performed at the Department of Orthopedics Rehabilitation, University of Iowa, US. As we know that the scoliosis is a three-dimensional pathology, the goal of the surgical treatment for the AS are to obtain a solid fusion while maintaining the correction. Over the past year, surgery has mainly focuses on the correcting the coronal curve, but nowadays the aim of the spinal fusion are to achieve a stable and well balance of the spine in both coronal and sagittal plane, so that the patient can get back to the normal of her life. After the era of the Harrington instrumentation, hook instrumentation system became the gold standard for AS treatment. But over the last 2 decades, pedicle screw systems have replaced our hook construct. For the pedicle screws, you can use alone or with a combination with the hooks that are often referred to as the hybrid, which can reduce the cost, operating time, and the risk of the screw complication, as the Ajahn Arisak said, that the misplaced position of the screw may be higher, around 8 to 10%, especially at the thoracic level. Many papers try to compare the result of the treatment between the hybrid and the PDS, but the results are still controversial. The hybrid system allows the deformity correction in the coronal, sagittal, and axial plane, but in terms of degree of the correction, there is no consensus which method provides the best correction. There's a paper that compared the pedicle screw and the hybrid system, and they show that the degree of the correction of the pedicle screw alone is around 65% compared with the 46% for the hybrid construct. So the PSDS refer as the proximally hooks, and the screw distally technique is a hybrid variation, ending the hooks at the proximal 2 or 3 levels in order to correct the coronal balance by distraction and compression technique, but still has the benefit of the correction of the by the PDS. Moreover, it can create a soft landing to prevent the PJK in the theory. So this is a retrospective study, was to report this technique in a single institution, focuses on the degree of the curve correction, coronal and sagittal balance. After obtaining the institutional review board approval, the medical records and the spinal radiograph of the patient with the areas surgically treated between 2006 and 2015 were reviewed. The inclusion criteria were the patient undergoing this technique with a minimum 2 years follow-up, and all the patients treated by same surgeon. The patient who underwent the revision were excluded. The data were collected on the age, sex, weight, research stage, curve pattern by the Lenke classification, and the radiographic analysis, including coronal and sagittal plane. With preoperatively, immediate 6 weeks and after surgery, and the last follow-up of the PA and lateral scoliosis-free EOS. The repeated measure ANOVA were used, and statistically significant was set at P less than equal to 0.05 is significant result. Between 2000 to 2015, 440 AS patients underwent posterior spinal fusion. From this database, 219 patients were met the inclusion criteria, with the mean follow-up around 41 months, and around 82% were female, and the research score around 2.91, The average skeletal hand bondage is around 5, and the operating time around 270 minutes. The intraoperative blood loss around 930 milliliters. The majority of the patients in this cohort is Lenke type 1 and type 2. For the coronal plane, the difference between the proximal curve, main thoracic curve, and lumbar curve is improved, especially from the main thoracic 53 degree to 18 degree and lumbar curve from 36 degree to 11 degree. This is the significant. And the percent of the correction for the proximal thoracic is around 44%, main thoracic 66%, and the lumbar curve 68% correction. From the radiographic shoulder height, the shoulder difference, preoperatively around 14.7 millimeters to the adult final follow-up around 8 millimeters. In the sagittal plane, the curve from T5 to T12, 27 to 21 degree, and the SVA minus 14 to minus 13. For the complication, we found that we found that 3.3% required the revision surgery, 2 because of infection, 1 because of pain and significant metallosis reaction, and 1 for PJK. There was no neurologic event in this technique. This is an example of the patient, 16 years old female with Lenke type 3 BN. The main thoracic curve around 65 degree and the lumbar curve 55 degree. And we used this technique. The difference of the shoulder is around 1.5 centimeters before surgery. We used the laminar hook inserted downwardly at the UIV level on the higher shoulder, and the other pedicle hook inserts upwardly at the level just below the UIV, and the other pedicle hook we insert upwardly to the side to push the lower shoulder up. And after surgery, she had good main thoracic curve correction and shoulders balance. So pedicle screw fixation has been considered biomechanically advantageous because it used the pedicle as the anchor, both anchoring the vertebral body as well as the posterior elements. The previous series have shown better major curve correction after all pedicle screw fixation than the hybrid. Our results show that improvement of the primary curve around 67%, which is comparable to the previous study using all the screw construct. And this particular construct seems to provide better correction, the major curve, than the previously reported hybrid construct. For the shoulder balance, not only the curve correction comparable to the PDS, but also the shoulder balance was better than the reported any series, which is around 85 to 90%. But in our series, we found that the shoulder balance is around 95% after surgery. What about the complication? One of the most widely discussed complications of all screws construct is the PJK. There is a literature found that the PJK complication from the screw only is allowed 35%, for the hook 24%, and from the hybrid is 29%. In our series, we found only one revision due to the PJK, but this doesn't mean that the rate of the PJK in this system is very low, that we need to do. We are on analyzing the PJK for this construct. So this is a retrospective in nature, and clinical values such as SRS score and patient satisfaction were not considered. Long-term follow-up of this technique will be needed in order to determine the improved deformity that is sustained over the long term. So in my conclusion, we like to introduce the PESDS is a variation of the hybrid And these techniques provide excellent curve correction, satisfactory improvement of the shoulder balance, and low complication rates without neurologic complications. Thank you.